Shocking numbers out from the San Francisco Chief Medical Examiner's Office showing drug overdoses killed more than twice the number of people than coronavirus last year in the city. And this year is expected to be even more bleak. Joining us now live is KRON 4's Maureen Kelly, who had an up-close and personal encounter with the drug epidemic just today. Maureen, what happened?
Well, Sanaz, this morning I was taking a walk when I came across a Good Samaritan calling 911 on behalf of a young man who was unresponsive and turning blue on a street corner in Potrero Hill. I remembered that I had a box of Narcan in my car, and I was able to administer it before the fire department arrived.
Here's video of first responders on the scene after the young man was starting to wake back up. They loaded him into the ambulance and gave me a replacement box of Narcan. It's a medicine that helps reverse the effects of an opioid overdose. Today, this patient will not be added to the grim tally of fatal accidental overdoses this year that is already looking to set a record we don't want. According to numbers released from the Office of the Chief Medical Examiner's Office, last year 712 people died from overdose. That's the black line you see on the graph. The colored lines show the kinds of drugs involved. Blue stands for fentanyl, which is involved in over 500 of last year's ODs. So far, from January to April of this year, the preliminary numbers show that we've already had 252 deaths, which is 70 more than during the same period last year.
We need to have people out on the street. We need to get people into treatment. We need to stop the fentanyl. We need a huge coordinated response on this. And it hasn't happened, and people keep dying. And now we may get to close to 3 people dying a day from drug overdose in San Francisco. Last year it was 2, and it's triple what it was 3 years ago.
Many of those deaths happened in Supervisor Matt Haney's district. He's pushing legislation that would require city contracted shelters and SROs to have Narcan accessible and overdose prevention protocols in place.
I was just shocked to find out that we have SROs where a huge number of people have died in city contracted or city run facilities where the people aren't trained, there aren't protocols in place, there's not necessarily Narcan available. I mean, that is not what it means to treat this as an epidemic.
Mayor London Breed is proposing to launch a street overdose prevention team that would provide follow-up care to people who survive overdoses. I'll have more on that part of the story coming up at 5 o'clock. Reporting live in San Francisco, I'm Maureen Kelly on 4 News.